Well, this is Mian Shah, and this is my Math 240 final project. And the model or the project that I chose is the SIR model, a mathematical model used to study how infectious diseases spread. This model is especially relevant today because of how it was used during the COVID-19 pandemic. I chose it because it combines math with public health in a really meaningful way. So, the introduction. The SIR model is a classical way in epidemiology that helps us understand how diseases move through a population. It breaks down people into three groups: those who catch the disease, those who currently have it, and those who have recovered and then are immune. The model uses differential equations, just like we've studied all semester, to describe how individuals move from one group to another over time. This basic setup gives us a powerful way to forecast three things: infection peaks, estimate total cases, and evaluate how well public health measures might work. So, why I chose this model? I chose the SIR model because it bridges two areas that seem unrelated, like abstract math and real life health. When COVID hit, I started seeing graphs everywhere. Infection curves, peaks, projections. A lot of those came from models like the SIR. And at the time, I didn't know what it meant, but now looking into it, I understand. From a student's perspective, it's really powerful to see how equations we learn in class can help with real life decision making. It seems like a lot of the stuff we learn in class usually doesn't apply to real world, but in this case it does. Also, the model is simple enough to explain how people without a math background, that kind of accessibility in math is rare, I feel like. It's not really simple to always explain math concepts or something very math related to someone who might not have a math background. So, history of the SIR model. The SIR model was developed in 1927 by William Kermack and Anderson McKendrick. At the time, public health measures were mostly reactive. Officials responded to outbreaks as they happened, with no tool to predict how bad they might get. This model changed that. Their paper introduced the idea that we could mathematically forecast the trajectory of an epidemic before it peaks. This changed everything. It laid the groundwork for the entire field of mathematical epidemiology. So, the modelers. Kermack was a chemist and a mathematical modeler, while McKendrick was a physician with experience trading outbreaks in the field. Their different backgrounds allowed them to build a model that was both mathematically and biologically realistic and effective. Their work inspired future generations of scientists who continued to improve and expand the model for modern use. And out of this came a multitude of models such as the SIRS, SIRV, etc. that we'll talk about later. So the equations. These are the core equations of the SIR model. Each one represents the rate of change in each compartment over time. The susceptible group loses people as they get infected. The infected group gains people from S and loses them as they recover. The recovered group grows as people leave the infected group. Two key parameters control the dynamics. Beta is the transition rate, how easy the disease spreads, and gamma is the recovery rate, how quickly people recover and leave the infected group. Together, they determine how fast the disease moves through a population. So, solving the model. Since these equations are nonlinear, we just can't solve them by hand. That's where numerical methods come in, like Euler's method, which we have used in class. In real-life outbreaks, scientists also use data to estimate the values of beta and gamma using curve, fitting, or statistical methods. Even if we can't get enough exact solutions, we can still analyze the system. When does the infection peak? How long will it last? And what percentage of the population will eventually recover? So, real-world applications. The SIR model has been used in real outbreaks, not just COVID-19, but also Ebola, measles, and the seasonal flu. Health organizations like CDC and WHO use it to predict how many people will get sick, estimate hospital capacity needs, plan vaccination campaigns, and decide when and where to enforce lockdowns. It's a great example of how applied math can directly impact and save millions of lives. Visualization 1. This simulation I created using beta 0.3 and gamma 1/14, which assumes the people recover in about 2 weeks. We start with 1% of the population infected and the rest susceptible. Over time, susceptible goes down as people get sick. Infected rises, peaks, and falls, and recovered increases over time. This ball curve is what we try to flatten with public health measures like distancing and vaccines. It's a visual way to understand the course of an outbreak, and to me it's very interesting and kind of easy to tell. It's color coded right there, so yellow, kind of pink, and orange. So, the second graph compares two different beta values, 0.2 and 0.4. So the infection spreads more slowly and peaks lower, and then the outbreak is fast and intense with the two different ones. This shows why it's so important to lower beta through masks, hygiene, and vaccines. Even small changes can buy time for hospitals and help save a lot of lives. You can see just the simplest change of point 2 and point 4 makes a huge difference. So for my Whoa, it's an interactive sim. I built an interactive tool that helps that lets you change beta in real time. When you slide the beta value up or down, you immediately see how the infection curve responds. Higher peaks, earlier outbreaks, or flatter curves. It was a really eye-opening way to experience how one number, just beta, can change the entire trajectory of an epidemic. Now I couldn't really add the code into here or the graph into here, but these are me just using two different values. The first one I used 0.16 for beta and then 0.5 for beta in the second one. So course connections. This project ties directly into our class. We learned how to solve systems of first order ODEs, use Euler's method for numerical solutions, and analyze how parameters affect outcomes. It's cool to see how these techniques work together in real-world application. It helped me to see what we're learning in class can actually make a difference outside of it. So questions I explored. So what if people get sick again after recovering? In that case, we would use a variation called the SIRS model, which will move people from R back to S. This applies to diseases such as the flu. And then what about vaccines? So we can either subtract vaccinated people from the susceptible group or use a separate V compartment to track them in the SIRV model. So in conclusion, to wrap up, the SIR model shows how something as simple as 3 equations can help protect lives. It helps us to protect how a disease spreads, plan hospital and vaccine strategies, and guide public health policies. It's a perfect example of theoretical math becoming practical, life-saving science. And these are my sources. Thank you for watching.